Dear students, today we are here with the oral antidiabetic drugs. In this session, we will study about the classification of oral antidiabetic drugs and detailed study about the sulfonylureas, in which we will study about their pharmacological actions, mechanism of action, and adverse reactions of sulfonylureas. So let us start with the classification of drugs. Classification. We have classified the oral antidiabetic drugs in a number of groups. Number first includes sulfonylureas. Sulfonylurea. In sulfonylureas, we have two categories. Number first is first generation and number second is second generation. In first generation drugs, we have tolbutamide, and chlorpropamide. In second generation drugs, we have glipizide and glimepiride. In sulfonylureas, we have two categories, that is first generation, which includes tolbutamide and chlorpropamide. In second generation, it is glipizide, glimepirides. Now, second group of drugs is bigonides. In this we have metformin. Number third, thiazolidinediones. In this we have rosiglitazone. Next we have alpha glycosidase inhibitors. Alpha glycosidase inhibitors, in which we have acarbose and miglitol. These are the common drugs which we do have in oral antidiabetic categories. Now we will study about the first group of drugs, that is sulfonylureas. Sulfonylureas were the first drug to be introduced in oral antidiabetic drugs. These were made available in 1950s. They are the derivatives of sulfonamides. Sulfonamides are the antibacterial drugs. given in typhoid. It was observed that these drugs in these patients cause hypoglycemia, which led to the development of the newer group of drugs that are called as sulfonylureas. These are the derivatives of sulfonamides, which are the antibacterial drugs given in typhoid therapy. So, let us first study about the mechanism of action of sulfonylureas. Mechanism of action. Sulfonylureas perform their action by stimulating the release of insulin from beta cells of pancreas. Number second, it increases the sensitivity of peripheral tissues to insulin. Number third, it increases the number of insulin receptors. This was the mechanism of action of sulfonylureas. Now coming to the absorption, fate and excretion of sulfonylureas. Absorption. Sulfonylureas are well absorbed on oral administration from gastrointestinal tract. They are partly bound to plasma protein. They are partly bound to plasma protein. And are metabolized in liver. And are excreted in urine. So these are given on oral administration. They are partly bound to plasma protein, metabolized in the liver and are excreted in urine. Now, this is about the pharmacokinetics. Now, adverse effects of sulfonylureas. These produce hypoglycemia. This hypoglycemia is potentiated by the drugs like phenylbutazone and salicylates. Means hypoglycemic effect is more potentiated by phenylbutazone and salicylates. Both these drugs are used as anti-inflammatory drugs. Next adverse reaction is allergic reactions. And is characterized by skin rashes. Next, it causes leukopenia. Leukopenia is decrease in white blood cells. Deficiency in white blood cells, and may also cause thrombocytopenia. Thrombocytopenia is decreased platelet count. count. Besides this, nausea and vomiting can also occur due to the adverse reactions. Now coming to the preparations of sulfonylureas. Preparations. It comes in tolbutamide tablets, 0.5 grams, 5 to 1 gram daily. Chlorpropamide tablets 250 to 500 milligrams daily. This was about the sulfonylureas. For further details, we will continue in next session. Thank you.